So it can mimic a lot of natural things in life that we can poo-poo, our symptom of heart failure. But this is one thing I want you all to remember. If you're walking like a mile a day, 2 miles a day, and then now you can only walk 2 blocks before you get short of breath, that's an objective sign that there's something going on. More often, with our human nature, we justify things. I'm getting older, or I'm getting so-and-so, or I've gained weight, we've gone on vacation, I haven't gone exercise for a long time, so we went on a trip to Florida, came back, and that's why I'm not walking as much. But you may be having heart failure and just not know it. It's shortness of breath, or dyspnea of exertion, we call it. The other symptom is persistent cough or wheezing. And I actually brought this up because, and I get into also with my colleagues about that and patients about that, because not all wheezing is asthma. Okay? Let me repeat that. Not all wheezing is bronchial asthma, or not all wheezing is COPD. Okay? Heart failure will present as wheezing also. So if there's any, I hope you can have a take-home message also. So if you've never been wheezing before, and you start wheezing, never had a history of, long COPD or asthma since childhood, and you start wheezing, there's a bigger chance that you have heart failure more than COPD. So I just want to bring home that point that wheezing can be also heart failure symptoms. Okay? And then building up of excess fluid in the body tissue. Now what is the most common place where people complain about fluid building up? Legs, right? Legs and ankle. Why does it build up in the leg? By gravity. Because when we stand up, remember, the body and the human hemodynamics has to follow the basic laws of physics. When we stand up, fluid theoretically should go to our legs. But we have mechanisms of pushing them back, But anyway, so we retain fluid, The legs is the most common, and I won't go into a lot of details with the other topics, but the other places where they can build up is in your hands. Another symptom, patients say, oh yeah, I noticed, my my wedding ring can't get off my hands anymore. Maybe you're retaining fluid also. And sometimes you can press the belly also and say, hey, there's fluid in the surface of the belly. That's when it really gets severe. So usually the leg starts with the lower leg, the ankles going up the legs, then the thighs, then the belly. The abdominal wall can have swelling and just edema there. One last caveat also I tell patients is, heart failure can be from fluid overload, usually from kidney problems. It's when you see the eyes swelling also. You look at the eyes and there's some puffiness of the eyelids. That's fluid also. That's another source of fluid retention. We look at that. But usually when there's fluid retention in the eyelids, it's also heart failure, but mostly there's an underlying kidney problem. Those are the patients getting close to dialysis or something. Their kidneys are in really bad shape. That's why it's going up. The kidneys are in so bad shape that they can't get rid of the fluid, that even the eyes are swelling and the eyelids are swelling. Okay? Now the other one is tiredness and fatigue. That is another common. That's the one, the shortness of breath and fatigue. And the reason I bring this up is because tiredness and fatigue are actually common symptoms of heart failure, but more often the underlying problem is from either sleep apnea or from valvular heart disease. The valves are leaking or the valves are not working well. And since the valves are not working well, this is a very gradual process. Very gradual, that you don't even notice that you're getting more tired, more fatigued. It's family members sometimes. I get this information. When I talk to the patient, they won't even notice that they're tired, fatigued. I talk to the spouse or the son or daughter and said, yeah, did your dad walk? Your dad could walk a mile or 2 miles a year ago, and now dad can only walk 2 blocks and he's tired, and he says, I'm just getting older. What? But the thing is, in 1 year, you don't go from 1 mile to 2 blocks. If we just been getting older, And so that's when I start digging. Well, is this only from getting older, or is more often than not valvular heart disease, and sleep apnea will present with these kinds of symptoms. Okay, but they are forms of heart failure also. The other thing is loss of appetite, nausea. Yeah. Nausea is another. We see this in advanced. This is more in advanced heart failure also, because when you eat heavy meals, your heart has to work harder to shunt blood to the belly. You know, and then so the heart has to work harder after meals. And if you have a very weak heart muscle, usually you can't tolerate heavy meals because the heart has to work so much harder that you start getting short of breath, and your it's a little complicated to explain, but your hemodynamics can't compensate. In fact, you know, we see this more in our pre-transplant, advanced heart failure, severe heart failure, and pre-transplant patients, and then when their heart failure is so bad they can't eat heavy meals, then they get very thin. It's called cardiac cachexia, actually. And that's a very severe form. Like I said, these are severe forms of heart failure, advanced heart failure that, you know, they go into cardiac cachexia because they can't eat and they have no appetite and everything, and they're very thin and even become technically malnourished, you know. And then the next one is confusion, paranoid thinking. That's when the blood pressure drops and you get short of breath, low output state. You can get confused, or you're just kind of, you know, thinking la la land, or you're getting lightheaded, and it's because you're not perfusing the brain. When you get confused, first thing is you're not perfusing the brain. Why you're not perfusing the brain? It could be a lot of things, you know, from clogging of the arteries of the neck to heart failure when the heart's not pumping enough blood to the brain circulation. That's why you can get confused also. Paranoid thinking comes with, you know, the confusion sometimes. And then heart rate increase, even at rest. This is an interesting phenomenon because this has been a target for management more recently with some new drugs, evadarabine. And remember how I said your ejection fraction is decreased and the heart has to pump faster? So even resting, the heart is pumping faster in the 80s and 90s. You know, normally your heart's down in the 60s, 70s, and the more fit you are, the heart rate goes down to 50s. The more athletic you are, the slower the baseline heart rate. This one, even at rest, your heart rate is increased. Heart rate is running at 90, 100. We always worry about heart failure when you see 100, 110 while sitting down, even though you are in rhythm, you know, because you may be in heart failure. And remember when I said about ejection fraction in the weak heart muscles, if it's pumping blood, well, if it's so weak, it's pumping a small amount of blood with every squeeze, it pumps less blood. Now, how do you think the heart and the body will compensate? It increases its heart rate. So by increasing your speed, you maintain your cardiac output in terms of liters per minute over 1 minute. So if your heart is pumping 60 beats per minute, it's only pumping, let's say, 60 cc per hour, you know. And then it compensates by pumping 100 times a minute, so your cardiac output goes up to 6 liters an hour. Okay, I don't know if these are all, I mean, you can look at it mathematically, that's how we kind of look at it in that sense, but the whole point is, I'm telling you, is if you notice that the heart rate is fast, even while resting, you know, have yourself checked because, you know, you may be having heart failure because the heart shouldn't be running 100, 110 at rest. Unless you have a rhythm disorder, that's another issue. So, but this one, I'm assuming that you are in rhythm. Okay. Of course, if you're out of rhythm, that's a different story. AFib is a whole nother topic again. But even in AFib, you know, atrial fibrillation. A lot of people in atrial fibrillation where we say the heart is out of rhythm. Even if you're out of rhythm, your rate should still be in the 60s and 70s. You're more comfortable. If you're in AFib and you're persistently in 100, 110, which is not enough to make you short of breath. If your resting heart rate is high, you may be having some heart failure symptoms also and need more titration of your medication. Okay? Going to the next one. How do we diagnose heart failure? First and foremost is history and physical exam. History and physical exam. You can call me old-fashioned, but 80% of the diagnosis can be made in a good history and physical examination. something I comment about. We have some medical students and interns and residents, how everybody's focused on test, test, test. But the good old story taking, ask the patient, what's going on? When did it start? You say, when did you start getting short of breath? How often are you getting? What makes you short of breath? What makes it better and what makes it worse? Simple questions. When does the symptom start? What makes it worse? What makes it better? And that holds true also for coronary artery disease. If you don't have chest pains, but you get short of breath, coronary artery disease may present with shortness of breath also. So you get a story. A year ago, you can walk 2 miles, and in the past 6 months, you can only walk 100 feet before you get short of breath. Just by getting that story comparison, you have something there. That means that should trigger you to get something done. So history and physical is an example. Or certain positions. You get short of breath while laying down in bed. You need to prop your head up. 2 pillows. I always ask, how many pillows do you sleep with? Because if you can't sleep with 1 pillow and you need 2 or 3 pillows to prop your head up to sleep, chances are the patient is flooding in fluid in his lungs. That's why the patient is trying to sit up in bed. Okay? Let me repeat that. If you can't lay down flat and you're so short of breath when you lay down flat, you may be accumulating fluid in your lungs. And that's why, to compensate, again, you use gravity. So you sit up so there's more air, it goes down here, and you have more air space to use.